Hello everyone, welcome to this channel. If you are watching it from YouTube, please subscribe to my channel, and if you're watching it from Facebook, please click that like button and be a part of our page. Okay, in this video we will talk about OET in general, especially for those who are totally new. So I'll give them some overview, and in next videos I will be talking about the rest of the subtests in detail. But for now, I'll just give you a detailed overview regarding OET, what OET is, what are its subparts, and what are you expected, what you need to do in order to get that good grade in OET. So please don't forget to like this page and subscribe to our channel to watch the next videos as well. As I said earlier, my name is Sajali and I'm a registered nurse, and this session is for beginners. I would want you to watch it till the end in order to get a full idea regarding OET. Let's just jump into the video, into the session, sorry. Okay, what is OET? It is an English test for professionals. And for which type of professionals? For healthcare related professionals. And this test is recognized by various regulatory bodies across the world. And what actually they want you to do, they want to check your communication skills from different angles. And what are those angles? They are listening, reading, writing, and speaking. So they want to check your communication skill from all these four angles, and you need to be good at all of them. And I will give you a detailed idea about all the subtests in the coming videos, so stay tuned with me and I'll guide you properly. Now, there are some rumors across the world in different people. They think that OET is easier compared to other English tests, which I think is not true. Actually, the difficulty level is always the same, but we healthcare professionals find it a little easier compared to any other English proficiency test, because in OET, all the topics you will see on the day of test will be either from medical research or any other research that will be related to health, and any topic that will be discussed either in speaking or reading, it will be either a disease or maybe anything else, but it will be related to healthcare. It will be related to healthcare setting. So that is the reason that we find it easy compared to any other test. So I hope it is clear for everyone. If you guys have any question, please don't forget to ask that question in the chat section, or you can even comment it down there. Okay. Now, which countries accept OET? It is recognized by different healthcare bodies in different countries. Australia, United Kingdom, New Zealand, Ireland, Spain, that accept this test, and some other countries do as well. USA, for USA in Florida, they do accept OET, but again, for visa process, they definitely need some other test. I will not say the name of those tests, but you can just go to Google and check it out there. And some other countries also accept it, like Philippines or any other countries. Now, OET has different systems. You may have come across other tests, they use the word band, but in OET, you will see grades. We have, in OET, there are different grades from A to E. So if your score is from 450 to 500, it will be considered A grade. But if it is between 350 to 440, it will be B grade, which is our target as well. We try to get B grade, and A is a little difficult because It is even difficult for native speakers. So for non-native speakers, B is more than good. And C plus is also acceptable for some countries. For nurses, if you're a doctor, you need to get B in all subtests. But if you're a nurse, for England in writing, C plus is acceptable, and for Ireland, they accept C plus in any of the subtests, but it should be only in one subtest. For example, if you get C plus in reading, you need to have B in all the rest of the subtest. I mean, in the rest of the three subtests, you have to have B grade. If you have, for example, C plus in listening, you have to have B grade in the rest of the three subtests. Then you will be considered eligible for Ireland, and for England, only in writing, C plus is acceptable. So that's our goal. We need to focus to get B grade. We need to get score over 350. I hope it makes sense to everyone and it is clear for everyone. If you guys have any question, please don't forget to ask that question in the comment section. Now, which professionals can sit for OET? There are different professionals across the world. Nursing and medicine are on top. Doctors and nurses can definitely sit for it, but apart from these two, pharmacists, radiographist, and professionals from physiotherapy, speech pathology, they can also sit for it. So in total, 12 professionals can sit for this test. So if you belong to any other profession, don't get disappointed. You can also sit for this test, but for example, if you are an engineer, obviously you cannot sit for it. This test is not supposed to be for you. But if you are related to health related professions, you may search your profession through the official website of OET. You'll find your profession there. But what you see right now on your screen, these professionals are definitely eligible to sit for it. Now, coming to subtests of OET, what are the four subtests? As I said earlier, there are four subtests: listening, reading, writing, and speaking. Now, let's discuss each of these subtests one by one and in detail. Listening and reading is always same for all professions, whether you're a doctor, you're a physiotherapist, you're a nurse, or you belong to any other profession. You will see the same test on the day of test. Your reading and listening will be the same for all. But writing and speaking is different. If you are a nurse, you will write from nursing point of view. Case notes will be given to you, and you will be required to write a letter. Whether it either will be transfer letter, it can be a referral letter, a discharge letter, and you will write it from nursing point of view. And everything you are required, you will be asked there in the writing task. And in speaking, there are always two role plays, and you will speak from nursing point of view. If you are a doctor, you will speak from medical point of view, and the same is for writing for doctors as well. Now, coming to subtest listening, it has actually three parts: A, B, and C. Part A has two extracts, each extract containing 12 questions, and in total there are 24 questions. Part B has 6 questions. Part C has two extracts, each containing 6 questions. I'll show it to you because it may make a little uh, confusion to you if you uh, just look at this slide and think that it's over. But let me show it to you how listening part looks like. I hope you guys can see my screen. Okay. I hope you guys can see the screen. Okay, as I said earlier, uh, in reading you have three parts: A, B, and C. This is part A. This is part A. You have two extracts in part A, each containing 12 questions. So in part A, this is extract 1. You have 12 questions. Look at this. You have 12 questions. Now the questions look like this. We also call them gap filled questions or fill in the blank type of questions. You will listen to a conversation between either a doctor and a patient, a nurse and a patient, a physiotherapist and a patient, but obviously there will be a patient and there will be a professional. So they will talk and you listen to them very carefully and listen to the word that fits this gap, and then you will write it here. So you need to, you know, read these words very carefully and understand them. So before this listening part A starts, or extract one starts, everything will be explained to you, and you will be given 30 seconds to read from question 1 to 12. From 1 to 12, all the way to here, and then the conversation will start. So there are different tricks and tips to it, how you need to read them in 30 seconds and know the keywords. I will upload them in the next video and I'll discuss them in detail. I would uh, I would want you to stay tuned with me for next video. Now this is how your extract 1 part A looks like. Now let's go to extract 2. This is your extract 2. Again, you have this patient, it will be told to you and everything will be explained to you before it starts. And again, you'll be given 30 seconds to read from question 13 to 24. This is your extract 2. So when you read from that, from question 13 to 24, the conversation will start. And again, you will listen to the conversation very carefully. And then you will catch the words and write them here in this blank. So this is how your part A looks like. I hope it is clear for everyone. Even if you have a question, you can ask in the comment section. So this is all the way to question 24. Now let's go to part B. Part B has 6 questions, as I said. For question 25 to 30, you have multiple choice questions. You have different choices, A, B, and C. And the good thing about part B is before each question starts, everything will be explained to you that now a doctor and a patient will talk, a doctor and nurse will talk, and a doctor physiotherapist will talk. And so this line, you will hear it through your headphone. You hear two doctors discuss the transfer of care for a patient. You will hear this line. Then you will be asked that now you can read the question, or you will be told that now you should read the question. The patient's curved 65 score means that he will. Now you will listen to a conversation very carefully, and you will also look at these options. So before they start, you read the question. You should read it very carefully, and the key point in this part is that you read it carefully and understand it. Without understanding the question, you will not be able to choose the correct answer. So once you read it, then you should come to the options, part option part A, B, or C, and read them. So then you will listen to conversation, and you should pay a very close attention and find out what they are actually discussing. So then you should choose from this one, and there will be a circle here. You will with the pencil, you will fill it. That is how all these questions are. You will hear this line, then you will read the question, and after reading the question, you'll read the options, and then you'll listen to a conversation. And after listening that, you need to choose one of them. So before each question starts, you will be given time that now, like this, you hear a speech pathologist talking to the wife of a patient who has recently suffered a stroke. Then you will be told, now read the question. The question is, what does she want to know about her husband's condition? So you do, When you read this, you understand it, then you should read these options as well. And then what you need to do is listen to the conversation very carefully, what they are actually discussing, and then choose the correct option from it. So this is how all the questions in part B looks like and how they work. I hope it is clear for everyone. You can ask the question in the chat section. Now, going to part C. In part C, you have two extracts again. Let me show it to you. Part C has two extracts, each containing 6 questions. So in each extract, you have 6 questions. Now, part C is difficult compared to part A and part B because in this part, you will not be given a separate time for each question. But before this starts, this is extract 1 of part C. This will be told to you here in an interview with Dr. Matthew Leach, who is talking about meningitis caused by this bacteria. Now, look at these questions. You will be given 90 seconds. 90 seconds for reading each extract. For extract 1, 90 seconds to read from question 31 to all the way down here to question number 36. Question number 36, look at this. In your next part starts, part 2, extract 2 starts. Now, again, this is very difficult because you will not be given a time. It will be a continuous dialogue or monologue. Maybe a person will be talking about a research they have conducted, or maybe there will be a conversation. So, like unlike part B, in part B you are given time before each question, but in this one, the upper part, this part will be told to you, and then you will listen to a continuous conversation. You will, in 90 seconds, you need to read all these questions and options as well. You may underline keywords in it, and then you will read listen to a continuous conversation and choose options from it as well. Like, you will not be told that now read question 31 or 32. No, they will talk continuously, and you should know that now where they are they in question 32 or are they in question 33? So you should know it well. This is how listening works. But in next videos I will talk about them in detail, but this is just an overview for the beginners. This is how part part C extract 1 works. Now coming to extract 2 of part C, again it's the same as it was in extract 1. You listen to this part. This part will be told to you. Then you'll be given 90 seconds again to read from question 37 to 42, and you should underline the keywords in questions and even in options, and then listen to the conversation and choose from them. And in order to get B grade in in listening, you need to have 30 correct answers at least. Okay, I hope listening is clear for everyone. Now coming to part B, reading. Reading, again, you have 3 parts, part A and part B and C. You will be given time. In listening, you are not bound to time, but in reading, you have 1 hour time. For part A, you have 20 questions. You will be given 4 small paragraphs or text. You need to have a good time management strategy because you will be given only 15 minutes. You have only 15 minutes for what? To read these small paragraphs and answer the 20 questions. So it's really difficult. You need to have a good strategy for it, and it comes with practice. I'll show it to you. Okay. I hope it is visible for everyone. Now this is how your reading part A looks like. You have different extracts. As I said, you have four extracts. This is text A. Sorry, not the extracts, you have text. You have four texts or four small paragraphs. This is your text A. You may see tables in it or graphs in it. This is text B. This is text C. This is text D. So now you have uh, 15 minutes. 15 minutes for what? 15 minutes for reading all the above text and then answering these questions. Question 1 to 6, then question all the way down to question number 20. This is question number 20. So you have 15 minutes to answer these questions and also read the above text. And answer to these questions come from the text above that you will read. So you need a good time management for it because it is really difficult to read these texts in 50 like you read these texts and then answer the questions down there in just 15 minutes. It's really hard. So I'll teach you strategies for it as well. Now this is how your reading part A looks like. Now going to part B, how the part B looks like. Okay, in part B you have 6 questions. Part B and C collectively have 45 minutes, and Part B has 6 questions. Each question needs to be answered from a small paragraph given with each question. With each question, you will be given a small paragraph or text from which you will answer the question. There will be 3 options, and the one you think is correct needs to be chosen. Okay. As I said, reading Part B has 6 questions. This is reading Part B. This is the small text as I was talking about. This is your small text, small paragraph, and this is the question. The notice reminds staff that patients who are dying will need to be prescribed antibiotics, might not need to continue with certain medications, should be encouraged to discuss their condition with loved ones. Now, what you need to do, read this question, and these are the options, and you need to choose these options. You need to choose one of them from where the correct answer will be here in this text. So you need to read it. So collectively for reading part B and part C, you have how much time you have? Like 45 minutes. So you should spend maybe 10 minutes on part B. This is question number second. You have the small text and there is a question at the end. You need to read this question. These are the options and this is the text. So you should choose correct from these options and the correct one comes from the text. You need to understand the question, go to the text and find the answer there and then choose from these options. There is also a strategy to it. I will tell you those strategies in the next videos. So stay tuned with me. Subscribe to the channel. Again, you have question number 3, small text, and there is a question. It has options as well. You need to choose from them. Now let's go to part C. Part C has 2 extracts, each containing 8 questions. So in total, you will be given how many questions? 16 questions in part C. And those 16 questions are divided into 2 texts, text 1 and text 2. And each extracts, extract 1 and extract 2. Each extract has 8 questions. 2 lengthy texts are given, each roughly has 800 words, and those questions should be answered from a long text you will be given. And those texts those texts contain at least 800 words. Each question has 4 options and you have to choose one. Let me show it to you. This is your part C. Part C, you have this is the extract one, and extract one you have this text. As I said, two texts will be given. Around it contains around 800 words. So this is a very long text. Look at it. This is a very long text, and these are the questions at the end. So the good thing about this, you will be told in the question that which paragraph you need to read. Look at this. The first paragraph explains that stress. Then you have these four options. So what you need to do is go straight to the first paragraph and read it and find answer to this question, and then come here and choose from these options. Look at this. In the second paragraph, doctors are said to claim that stress. Look at the question number 8. In the second paragraph, doctors are said to claim that stress, and you have these options. And you need to go to second paragraph and find answer to this question, and then choose here. Now there are different questions in part C, reading. Some lexical questions, normal questions, statement type of questions, and some other questions as well. And for each question, there is a different strategy which you need to adopt. So I'll discuss those strategies in next videos as well. This is how all these questions look like. You have these questions. These are called lexical questions. So you need to go straight to this part and read it and find answer to the question. This is your text. This is your extract one. This is referral question. Look at this. This underlined word. Now your text 2 starts or extract 2 starts. Again, you are given a lengthy text containing around 800 words, and there will be questions on it at the end. Look at these questions. Again, in the first paragraph, the writer mentions the role of 20th century literature in. You have these options, so you need to go to the first paragraph as it is said in the question and find answer to it. Again, look at question number 2. What do we learn about schizophrenia in the second paragraph? So go to second paragraph and what do you learn about this problem? And come to the options then and choose one of them. This is how your reading part C text extract 2 looks like and works like. So again, you have different questions in it. I hope it is clear for everyone. If you guys have any question, please don't feel shy to ask me in the chat section, or you can even message me directly. You can ask it in uh, the comment section as well. If you are watching it through YouTube, you should comment down there, and I would request you to subscribe to my channel. That will be a really good support from your side to me. So I hope it is clear for everyone. As I showed you, part C has two extracts, each containing 8 questions. Two lengthy texts are given. Each roughly has 800 words. Each question has 4 options, and you have to choose one. Okay, now let's go to OET writing. You will be asked to write a letter. 3 types of letter we have. Referral letter 99% of the time, discharge letter, and transfer letter. Each letter has different format. Each letter has a different format. For example, if you are supposed to write a discharge letter, you cannot write it like a referral letter. And if you are supposed to write a referral, you cannot write it like transfer letter. For each question, there is a different strategy, and you have to adopt a different format. And the format, it depends on which type of letter you're writing. For example, in transfer, you have a different sequence for paragraphs, And in for discharge, you have a different sequence of paragraphs. For example, in what will you be required to write in first paragraph? What about second paragraph? What about third paragraph? And it also depends about the recipient to whom you're writing. Is it a health related professional? Is it somebody who does not know about medical terminology? So you should be very careful about data as well. I will discuss it with you in coming videos as well. So I'll just show it to you how these letters look like. This, I'll just show you a transfer letter. You'll be given case notes, and you'll be asked to write a letter. Look at it. These are the case notes. In case notes, everything will be mentioned, details about the patient. Look at this. You are the nurse in community health center. A patient you have been monitoring is moving to another city to live with his daughter. Name, Mr. Peter Dunbar. Date of birth, 18 March 1932. Current medication treatment record. Look at the treatment record. September 2017, what had happened to the patient in 18. So you will be required to read all these case notes, and at the end you are given this task. Using the information given in the case notes, write a letter to the community health nurse in the setting outlining the patient history and questioning. I'll zoom it a little bit. Okay, I hope you guys can see it now. Address the letter to community health nurse, Eastern Community Health Center, 465 East Street, Centralville. So this is your writing task. What you need to do, you need to write 180 to 200 words. Look at this. You will be asked to write 180 to 200 words. So before this writing task starts, you will be given 5 minutes to read the case notes. In those 5 minutes, you cannot write down anything. You need to just read, only read. You cannot even underline anything. After those 5 minutes, you will be given 40 minutes for writing. You can write in those 40 minutes. You can even read in those 40 minutes. It depends on you. And how you need to write a letter, I'll show it to you how you need to write the address and everything. Look at this, writing subject letter of transfer. This is how you write the address as it was given in the writing task. This is how you write the date, dear nurse to whom you're writing, then a reference. This is the name of the patient, date of birth. This is your introductory paragraph. What you need to write in the introduction, I'll tell you in next videos. I'll make videos about it. Then these are the sequence of your paragraph. Like what you need to write in first paragraph, what about second paragraph, what about your closing, what about your this part, and then down there your designation. This is how it looks like. It is just an overview. I'll talk about them in detail in next videos. Again, if you guys have any questions, you can comment down there and I'll respond to you. I hope it is clear for everyone. You will be given detailed case notes regarding patient as I showed to you. A task will be given mentioning what type of letter to write. As I showed at the end, there was a writing task in which you were asked to whom you should write and what you need to write. You are required to write 180 to 200 words. Now coming to speaking. In speaking, you will be given 2 role plays, total of 20 minutes you will have, 3 minutes for warm-up questions, 3 minutes for reading each role play card and preparation, 5 minutes for each role play. Now, okay, let me show it to you. It makes a little confusion if I just talk about it. Okay, this is how your role play card looks like. This is for your patient. Look at this. This is for your patient. And this is for you, for nurse setting. Look at this. This is for nurse setting. So you will be given, like when you enter to the room for speaking, first of all, the interlocutor, what you call your examiner, will first ask you about your identity. They will check your passport. And then what they'll do is they'll give you 3 minutes for warm-up questions. In warm-up question, the interlocutor will ask you about different things like maybe your profession or your motives in future. And these questions are not in the grading criteria. You don't need to worry about it. You just have to speak as much as possible in order to get into the rhythm, to know the accent of your interlocutor or your examiner. So you should speak as much as possible in those 3 minutes. After those 3 minutes, you will be given 3 minutes for reading the role play card. So when the role play card will be given to you, you need to first read the setting. That where are you working, because you will include this setting in your introduction. Then you should read about this part. This is the details of your patient. You are speaking with a 35-year-old who has recently been diagnosed with anemia, and then these are the tasks you need to do in your speaking. Find out if the patient has any question regarding the diagnosis. So what you need to avoid in speaking is you don't have to um, ask these questions directly. Like you don't need to use these words. You can change, you can convert it into your own sentences or your own words, or maybe you can even simplify this, and then you should ask it to the patient. So you have 5 minutes for completing these tasks. You don't have to finish it before 5 minutes, and you don't have to take more than 5 minutes, because that will not be good. And you will be given 5 minutes for it. And after finishing first role play card, you will be given a second role play card. And again, you will be given 3 minutes for reading it, the details, and then 5 minutes for completing the task. This is the next one. You will be given a next role play card, and you should read it in 3 minutes. Read the details, these tasks. You can underline if you want. You can write down some questions if you want. And in 5 minutes, you will be required to complete it. This is how your speaking works. You, okay, and now in speaking, what actually they want to see in you, your clinical and linguistic skills are assessed. Linguistic skills have further 4 parts and are scored on a scale of 0 to 6. Clinical skills have further 5 parts and are scored on a scale of 0 to 3, which I will discuss in next videos. So thank you so much, guys, for listening to this video and attending this session. If you guys have any questions, please ask me in the comment section. I'll respond to you. And if you want to get in touch with me directly or attend my course, please don't forget to mention it in the chat section. And if you're watching it from Facebook, you can message me directly. I'll get back to you. If you want to join my course, I'll guide you privately. I'll talk to you. I'll maybe make groups for you guys. So you can do whatever you want. And I'll try to upload a video on every second day or third day to this channel. So please don't forget to subscribe to it, and there's that will support me. And please don't forget to give us a thumbs up. You can, you should, you may like this video. I'll be very thankful to you guys. So thank you so much, guys, and I hope to see you in next videos. Thank you.